Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Damodhar Nerella. He he's an MD in internal medicine from Brooklyn University, New York. He started his practicing of internal medicine in Anderson, South Carolina since 2004. He was medical director for several nursing homes and assisted living facility for several hospice facilities. So currently he is a medical director for utilization management. So without any further delay, let's welcome Dr. Damodhar Garu onto our show. Dr. Damodhar Garu, welcome, Andy. How are you?
Hi, Andy. Good evening. Good evening. I'm fine and thank you. And Sakshi ప్రేక్షకులందరికీ నమస్కారాలు.
It's wonderful having you on our show again. So without any further delay, let's get on to the topic today. So today we did decide that we will be covering a little about the viral infections and something really basic that we're discussing, but also very important. So the first question to you is, nowadays you see there is a lot of viral fever or these like viral kind of things happening here in India, especially. People are getting sick. If one person in the family is getting sick, now automatically everybody is getting sick, and especially the kids, Can you please tell us what exactly is the situation here in India?
Beginning winter season, I think a lot of virus, they kind of get activated. Usually, viruses are like cold natured, ఇప్పుడు ఇక్కడ ఇండియా మీరు కరెక్ట్ క్వశ్చన్ అడిగారు. ఇండియాలో వైరల్ ఇన్ఫెక్షన్ ఎందుకంటే ఉన్నాయి, అది బయట కూడా ఉన్నాయి. కానీ ఇండియాలో ఎందుకంటే ఇప్పుడు సపోజ్ ఇప్పుడు మోస్ట్ కామన్ ప్రాబ్లం ఇప్పుడు డెంగీ ఫీవర్ కదండి అక్కడ కరెంట్ సిచ్యువేషన్ లో. సో ఇట్స్ అది కాజ్ ఎందుకు మస్కిటోస్, రైట్? సో మస్కిటోస్ హ్యావ్ టు బి కంట్రోల్డ్. Mosquitoes have to be controlled. So basically it's an environmental issue again, right? So mosquitoes can be because of breeding various reasons, like dirty water, all that stuff, So అది ఎన్విరాన్మెంటల్ ప్రాబ్లమ్. ఇండియాలో కొంచెం ఎక్కువ. ఇప్పుడు అమెరికా కంపేర్ చేస్తే అమెరికా ఇన్ఫ్రాస్ట్రక్చర్ కొంచెం అంటే దే ఆర్ అడ్వాన్స్డ్, సో ప్లస్ దే టేక్ ప్రివెంటివ్ మెజర్స్. సో వన్ ఆఫ్ ద రీజన్ అది ఇండియాలో ఎందుకు ఎక్కువ అంటే, ఇంకా అనదర్ ఈజ్ లైక్ లెట్స్ సే ఇప్పుడు నిపా వైరస్, రైట్? నిపా వైరస్ కేరళలో పెద్ద ఇట్స్ లైక్ బికమ్ ఇష్యూ, రైట్? సో అది ఎట్లా ట్రాన్స్మిషన్ అవుతుంది, like oral, fecal oral, like, So, and there also, main problem is, again, sanitation, water, right? A lot of times being transmitted through the water. So, and next thing is the third point I can say is the population, and, like spread is very fast. Like, see, most of these viral infections, they spread through droplet. Droplets. So when you sneeze, cough, like it spreads like millions viruses. Like look at COVID. Thank God it's kind of not scary anymore, right? So it created a big havoc. So like the rate of transmission is very high in India because of the density of the population, right? So those are the things different compared to advanced, like especially America. So that's the reason. So advise people how to prevent this. I mean, like obviously control of the environment. Like pollution, and there's so many programs on that topic. We don't have to go into that topic. But I mean, like let's say in our house, if we want to protect our children, what we do? We have to keep mosquitoes away, right? So mosquitoes away and get rid of the stagnant water where the mosquitoes breed. Drink clean water, right? The third thing is, of course, everybody knows, everybody's doing like wearing mask and all when you are in the crowds, to not only for other people but also for you, because you may get infected from other things. So if we can do those three things, I think that's going to solve a lot of problems in India.
Doctor, a lot of people, like, what they are saying right now is people are not able to understand what is COVID and what is, this viral fever again. So see, even if I get fever, there are of course different
Mhm.
symptoms to different people.
Mhm.
What really happens is that even though if I am, if I get fever, I lose a certain amount of sense of taste and smell. Of course, that's pretty common in every fever. So now what they're complaining a lot in India is that we're not able to differentiate between these virals and this COVID, whatever is happening. Is there any way that these people can differentiate, or what's the solution for this?
First thing, Andy, thank God, COVID is, I mean, like, it's not, you know, deadly anymore. So it has become not a weak type virus. Flu virus, you take it, it's called influenza virus. It's like a, annual issue in America. So every year, especially healthcare personnel, children, elderly people, most of them get a shot every year, Andy, including me. Otherwise, I have to give a reason why I have not taken when I have to work in a hospital, healthcare system. సో అట్లనే ఇప్పుడు ఈ కోవిడ్ కూడా అలాంటి వైరస్ లాగానే మారిపోయింది అన్నట్టు. ఇప్పుడు అది కూడా ఇప్పుడు ఇన్ఫ్లుయెన్జా అనే ఫ్లూ కూడా ఇప్పుడు ఇమ్యూనో కాంప్రమైజ్డ్ పీపుల్ people with young people with still not immune, and also older people who lose their immunity, and that kind of elderly situation, they have to be very careful with any viral infection, because a small simple virus can become deadly. Like, it can kill you, because what happens is, like, మీరు అన్నారు కదా, స్మెల్ అది ప్రాబ్లం. ఇదేమవుతుంది, వైరల్ ఇన్ఫెక్షన్, it will affect the upper respiratory system, and where you have most of these sensory receptors. So it's not just COVID, any kind of upper respiratory illness can affect a little bit. I'm sure ఇప్పుడు ఏమైందంటే కోవిడ్ కూడా చేంజ్ అయిపోయిందండి. ఇప్పుడు ఎన్నో వేరియంట్స్ వచ్చినాయి. ఒక వేరియంట్ ఓన్లీ మజిల్ వీక్నెస్, ఒక వేరియంట్ ఇనిషియల్ గా ఇవన్నీ ఉండే సిమ్టమ్స్. సో నౌ ఇట్ జస్ట్ బికమ్ లైక్ ఎ రెస్పిరేటరీ వైరల్ ఇల్నెస్. So I think thankfully, everybody was hoping it will become like that, and it became so. సో ఇప్పుడు అమెరికాలో ఏంటి అంటే, ఇప్పుడు ఈ కోవిడ్ ఎక్కువైంది మళ్ళీ కొంచెం. వాట్ ఎవర్ రీజన్స్, ఇట్స్ హార్డ్ టు సే వెదర్ ఇట్ ఈస్ సీజనల్ ఆర్ నాట్ సీజనల్, బికాస్ కోవిడ్ మీద ఇంకా మనకు కంప్లీట్ కన్ఫర్మ్ డేటా లేదు. సో ఎందుకంటే అది వింటర్ లో ఉంటుంది, సమ్మర్ లో కూడా ఉంటుంది కొన్ని కంట్రీలో. సో అందుకని ఏం చెప్పలేం. సో సో బేసికలీ ఇక్కడ ఏంటంటే, అమెరికా ఇక్కడ బూస్టర్ స్టార్ట్ అయిపోయింది, ఎస్పెషల్లీ హెల్త్ కేర్ పర్సనల్ కి, ఎల్డర్ కి, అండ్ యంగ్ కిడ్స్. India, I don't see much news right now. So, there are various other small, this like disease acts or whatever, Nipah virus and all that. Dengue is actually been a problem for a long time. But, it will get better because India is progressing much faster than, everybody anticipated, right? So hopefully, things will change, you know. So, other than this situation.
And also, doctor, let's talk about these common viral fevers that happen. So of course, the symptoms, the ways that you've said, it's pretty, like, the way it's spreading is sometimes really unknown. Sometimes it can be through a touch, or if there's any contamination of food or stuff like that. So what are some precautions that these people, especially people with kids, they have to take? Because I think nowadays kids are very easily prone, they're not as strong, their immunity isn't that strong as it was for the kids who were born 20 or 30 years ago. Of course, the immunity is compromised here. So in what ways can these parents have these follow these some preventive measures actually?
I think kids and old people, are similar. Like, even though there is age difference, you have to take care of them like exactly, like the same way, they need diapers, and, old people need diapers. సో బేసికల్లీ ఇక్కడ చెప్పేది ఏంటంటే, ఇమ్యూనిటీ కూడా సేమ్ అయిపోయింది వాళ్ళిద్దరిని టేక్ కేర్. సో ప్రివెంటివ్ మెజర్స్ టు హిట్ ఇట్ స్ట్రైట్ టు యువర్ క్వశ్చన్. ఫస్ట్ థింగ్ ఈజ్ ప్రివెన్షన్ అండి, లైక్ mosquitoes control. Nowadays dengue is commonly spread by mosquitoes. So make sure you keep your especially the kids' room mosquito free, especially young kids. We have so many ways to control mosquitoes now. And the second thing is water, and water. You have to really take care of the water. commonest root and source, is also water, right? And the third thing is obviously we discussed, in festivals, functions important. But I mean, like if the kid is sick, maybe probably kind of not exposing them to a lot of people also helps, because the route of spread is in like mass population, right? And of course, the next thing is most important thing is nutrition. You have to have a nutritious diet to build their immunity. There's so many facilities and information available everywhere. So those are the things. And then even after doing all this, the kid may get sick. So you got to be careful. The next thing is, okay, like let's say dengue is there. Okay, you got to be really careful after that fever continuation. You know what I mean? You got to quickly get, like, after 3 days of persistent fever, you got to make sure it's not dengue. Things like that. And and getting the right treatment is important. So that's the last part. Sometimes we cannot avoid. Even though we are safe, we are vulnerable. Being a living thing, right? So అదండి. So ఇవి పాటిస్తూ, I mean, like, again, there is always something new coming, so we have to be a little more aware of the social media also.
Doctor, my next question to you is, you as in you yourself practice internal medicine. So what are these like common health problems that you see, especially something related to viral? So are there any specific things, and what is that one common link that you find in all of these patients?
So virus, like, good, and especially to build up immunity, the kids, get little, infections which will make them immune, which is good. But again, like viruses, there's like RNA virus, there's a DNA virus, and there's so many weird ways how they multiply and how they infect people. Let's say you compare with COVID virus, COVID-19 virus, with other viruses. It started as a really dangerous one, and like either other virus, it has also become weaker over a period of time. So I think right now, I think the worst thing was HIV, immunodeficiency virus, which thankfully, the research and the scientists have really done a fabulous job. So nobody's scared of HIV virus anymore. But HIV is still there, and it will continue to be there. మీ పాయింట్కి ఏంటంటే ఇక వల్నరబిలిటీని చూసుకోవాలండి మనం. లైక్ లెట్స్ సే మన ఏజ్ గ్రూప్ తీసుకుందాం. ఇఫ్ యూ హ్యావ్ లెట్స్ సే rheumatoid arthritis, or something you are taking steroids to control the disease, or any chemo. So those people also have to be very careful. And I mean, like, after 50 years, you have to get a pneumo vaccine, pneumonia vaccine, and a shingles, vaccine, which helps because zoster is very common after 50. So I mean, like, there's so many ways. But again, virus. I mean, like, there were virus before, according to the situation and behavior of the new viruses.
And also, doctor, let's talk a little bit about what these common diseases that kids go through. So the one thing that I've noticed a lot is that because they're in school, because they're in contact with so many kids around them, if someone has cold, of course the cold catches and then it worsens. Now here in India, in America, allergies are pretty common. So people actually understand, is that a cold or is that an allergy? But here in India, not a lot of people have that idea. There are times when even my own mother she thought, I was just having a cold reaction, something. Turned out I was actually having an allergic reaction. So something for the viewers in India, how can they differentiate between a cold and an allergy?
Right, very good, Andy. A lot of times over treatment అంటారు కదా. So most of the time, especially, even it happens here also. I mean, like, if you don't want to take risk, so people just go ahead and treat both of them. But to answer, the correct thing is you have to differentiate because a lot of times these antibiotics can cause side effects, right? So allergic upper respiratory symptoms go along with viral or any other respiratory. But the problem is allergic is going to be having a triggering factor. So what's triggering it, and it's also if you keep an eye, it's a recurrent problem, right? Like let's say you are allergic to let's say pollen, flowers, certain flowers. So you get precipitated and then you get better and then you expose again. So you will come to know eventually because it's a recurrent trigger thing. Same thing like food. If somebody is allergic to, let's say, the common is peanuts. Peanuts allergy very common. So the pattern ఉంటుంది ప్లస్ ఇంకా లాబొరేటరీ వర్కప్ చేస్తే కంప్లీట్ గా కంక్లూడ్ చేయవచ్చు బట్ ఇట్లాంటి చిన్న చిన్న వాటికి టెస్ట్ చేయలేము. సో బేసికల్లీ క్లినికల్ గా అంటే ఆబ్వియస్లీ కొంచెం ఫీవర్ ఉంటుంది, అలర్జీలో ఫీవర్ ఉండదు, రైట్? కొంచెం ఈచింగ్ సిమ్టమ్స్ ఉంటాయి, ఎక్కడన్నా ర్యాష్ ఉండొచ్చు, అలర్జీ ఉంటాయి. ప్లస్ ఇన్ఫెక్టివ్ అయితే ఓన్లీ లేటర్ స్టేజ్ లో ర్యాష్ రావచ్చు. సో సో ప్లస్ ఫీవర్ ఉంటుంది బేసికలీ. ప్లస్ దే లుక్ మోర్ సిక్కర్ అండి, అలర్జీ అంత సిక్ ఉండరు. సో ఈ బేసిస్ మీద ట్రీట్మెంట్ చాలా మటుకు ఇస్తారు, ఎందుకంటే ఇవ్వాలి, ఎందుకంటే ప్రతి ఒక్కరికి బ్లడ్ టెస్ట్ అవన్నీ చేయలేము కదా. బట్ ఇఫ్ ఇట్స్ ఎ రికరెంట్ ప్రాసెస్ then you have to address the allergy, like there's so much research happening. You can find out, there is patch testing and there is preventive medication like Singulair or an steroid inhaler. So those are the things which will help the allergy patient to kind of going into asthma attacks and all that stuff.
Yeah.
So that's important, right?
Doctor, the one thing that, a lot of doctors, I've interviewed so many doctors, but the one thing that they always say is that it's very important that you look after what you're eating. It's very important. Everything is directly or indirectly always related to what you're eating, your eating habits, what are you drinking and stuff like that. So my question as a non-doctor is that, okay, you're eating so many different stuff, but then don't you think it's really important to maintain your gut health too? I feel like even if I'm eating something, I make sure I give that extra preference for my gut health. So there will be times where I will drink a probiotic, sorry, if I am having any, junk food. I just, kind of give a little importance on that. Can you please tell to the viewers watching that no matter how much
Sure.
you're doing, whatever medicines that you're doing, it's also very important to make sure that the gut health is fine?
Oh yeah, of course, Anil. I think that's a very important thing. And gut immunity is very important. So basically, nowadays with all the stuff we are putting in, like there is a saying, and what you put in will come out.
Yeah.
so, so basically, you have to choose wisely, because it's your body. So, ఇప్పుడు antibiotics ఉన్నాయి, they can literally alter your flora. సో అప్పుడు ఏం చేయాలంటే you can take a probiotic with like once or twice a day when you are taking antibiotics, or you can also continue yogurt and like curd, have a little bit of curd because it has a lot of probiotics. So I think like మన మీల్స్ ఒకప్పుడు పెరగన్నం లేకుండా ఇట్స్ ఇన్కంప్లీట్ మీల్ అనేది కదా. సో ఐ థింక్ ఏదో రీజన్ ఉంది, మన పెద్దోళ్ళు చెప్పేది అట్లా. నాకు ఈవెన్ దో ఐ వెంట్ త్రూ యునైటెడ్ కింగ్డమ్ ట్రైనింగ్, యునైటెడ్ స్టేట్స్ ట్రైనింగ్ అండ్ ఆల్ దట్, బట్ I think I still respect our culture because there's something. See, ఇప్పుడు చూడండి, it has come back. The yogurt has come back. The curd has come back. Like ghee has come back. సో యోగర్ట్ తో కూడా అవాయిడ్ చేయొచ్చు గట్ హెల్త్. ఇంకొకటి ఏంటంటే మోస్ట్ ఇంపార్టెంట్ థింగ్ ఏంటంటే ఇప్పుడు మన ఏజ్ గ్రూప్ వాళ్ళకి ఆఫ్టర్ 45 years, ఇంతకుముందు 50 years ఉండేది గట్ అంటే కొలనోస్కోపీ అంటారు. ఇప్పుడు యాక్చువల్లీ దాన్ని 45 yearsకే రెడ్యూస్ చేశారు. సో 45 years వచ్చిన తర్వాత కంపల్సరీ కొలనోస్కోపీ స్క్రీనింగ్ చేయించుకోవాలండి. సో చేయించుకుంటే ఏమైందంటే ఎర్లీ క్యాన్సర్, ఈ కోలన్ క్యాన్సర్ కొన్ని అగ్రెసివ్ ఉంటాయి, లోవర్ కోలన్ ఎస్పెషల్లీ. వితిన్ రియలైజ్ అయ్యేసరికి చనిపోతుంటారు. మా యాక్చువల్లీ వెరీ గుడ్ ఫ్రెండ్ ఆఫ్ మై డాక్టర్ హియర్ ప్రాక్టీసింగ్ ఇన్ డ్రీమ్విల్ died with colon cancer within no time, like 6 months. గైడ్లైన్స్ ఉన్నాయి కొంతమందికి, లైక్ ఫ్యామిలీ హిస్టరీ ఉందనుకోండి, వాళ్ళకి ఇంకా తొందరగా చేయాల్సి ఉంటుంది. ఎందుకంటే కోలన్ క్యాన్సర్ ఇస్ ఆల్సో డెడ్లీ డిసీజ్ which can be preventable, like breast cancer. Now how much research happened and people are getting advanced. Colon cancer would early diagnose just so they can be addressed very nicely. So that one thing I would suggest everybody to get a colonoscopy, screening colonoscopy after 45 years, very useful investment. గట్ హెల్త్ అంటే ఇంకా ఫైబర్ తీసుకోవాలండి. లైక్ ఎస్పెషల్లీ వన్స్ యూ ఆర్ గెటింగ్ ఇన్ టు కైండ్ ఆఫ్, ఐ థింక్ ఇట్స్ గుడ్ టు స్టార్ట్ ఎర్లీ ఏజ్. బట్ ఫైబర్, యూ యాడ్ ఫైబర్, యూ యాడ్ ఫైబర్ టు యువర్ మీట్. So you enjoy meat, but you add fiber, you add your vegetables to the same thing. Rather than eating meat with rice, you add vegetables, fiber. So you mix with vegetables, and I think that's a good way to go.
And also, doctor, can you suggest a few tests for viral? So when if somebody is getting a lot of viral fevers, very regularly, because see, in here, of course, I don't know about there in USA, but then in India, today is so hot, but yesterday it was really cold, and the other day it was raining. So of course, there is a continuous climatic change that is happening, and of course, our body is gonna take a little while for it to adapt. So if somebody is getting continuous virals, very regularly, or is getting sick very regularly, what kind of tests do you want to suggest to them? Or just like in a preventive way, anything that you can suggest?
Sure, yeah, I would, Andy. I think that's a good thing. See, you nailed very good points here. So basically, to go straight to your answer, somebody is getting recurrent, illness, viral illness, that means there is something wrong. Like the main thing is immunity. There's a lot of immune, deficiency conditions, right? So those, you can, test it like, like immunoglobulin test, like. So you definitely have to refer them to an immunologist who can work him up and see if they have any genetic issues. So then they can, supplement, treat cheyొచ్చు అది. మనం immunoglobulin ఇచ్చి వాళ్ళ immunity boost చేయొచ్చు. It's very important question. And second thing, like మీరు జనరల్ గా చెప్పింది వెరీ గుడ్ పాయింట్ చెప్పారు. యాక్చువల్లీ మీరు న్యూస్ ఫాలో అయితే 2-3 రోజుల కింద న్యూయార్క్ లో మెన్హాటన్ సిటీలో వాటర్ వచ్చేసి మొత్తం ఈవెన్ సబ్వే బంద్ చేయాల్సి వచ్చింది. న్యూయార్క్ సిటీ మెన్హాటన్ అంటే ఇంకా వరల్డ్ లో అది ఇక మెన్హాటన్ ఇస్ ద రిచెస్ట్, నాట్ రిచెస్ట్, రియల్ ఎస్టేట్ వాల్యూలో నెంబర్ 1 అది. సో అక్కడ మీకు సబ్వేలో నీరు పోయి ట్రైన్లలో నీళ్ళు వచ్చి ఆగిపోయినాయంటే ఈ పవర్ఫుల్ ఓన్లీ నేచర్ అండి. గాడ్ ఈజ్ ఓన్లీ పవర్ఫుల్ నేచర్. ఈవెన్ దో ఇంత అడ్వాన్స్మెంట్ ఉన్నా ఏదైనా కానీ. సో ఇది ఎందుకు అంటున్నా అంటే ఎన్విరాన్మెంట్ కంట్రోల్ ఈజ్ వెరీ ఇంపార్టెంట్. ఇప్పుడు గ్లోబల్ వార్మింగ్ అయినా ఏదైనా, ఇవాళ వర్షం పడుతుంది, రేపు ఇది అవుతుంది, ఇక్కడ కూడా సేమ్ సిచ్యువేషన్. సో ఐ థింక్ ద మోస్ట్ ఇంపార్టెంట్ థింగ్ ఈస్, యాజ్ అ హ్యూమన్ బీయింగ్, సో మై ఓన్లీ advice is, if you can help, you should, but you kind of should not make it worse. Like, if you cannot, just, don't, do it, So whichever way it affects the environment.
Indian culture is going Western too. Now, Western people are kind of incorporating a lot of Indian remedies that we do here. But here it is pretty same. The Indian culture is still going on, but then again, there's a lot of Western influence too. Nowadays, I think it's because of the, I don't want to use it even. I use social media every single day, but that's kind of, creating a wrong impact here. People are doing everything excessively. There was a time, especially during Corona, you would have these like WhatsApp messages saying you're supposed to do this, you're supposed to do that. Something was so excessive that even cost lives to so many different people. So how important is it that you want to say to the viewers who are watching to not blindly follow these kind of, really stupid remedies that are happening, and how dangerous this can actually be in future?
అవునండి. I think that's a common problem. But you know, I think India మీరన్నట్టుగా I mean like India is getting there అండి. I think culture is very important. Culture, for any country. I've been to Japan just few months ago. So Japan, was very advanced and actually most cleanest country in the world. I think. What surprised me there is they stick to their language అండి.
Yeah.
బిల్బోర్డ్స్ చూడండి. బిల్బోర్డ్స్ లో కూడా ఎక్కడో ఒక జాగాలో ఇంగ్లీష్ లో తప్ప అండ్ దే మెయింటైన్ దేర్ డ్రెస్సింగ్ ప్యాటర్న్ దేర్ ఈవెన్ దో దే ఆర్ టెక్నికల్లీ వెరీ అడ్వాన్స్డ్.
Yeah.
Japanese cars are my first car was Japanese when I was in London. So I mean like even now like we are so much dependent and they are so much advanced. Bullet train. I've been there a couple of times on the bullet. So వాళ్ళు ఈవెన్ బుద్ధుని యాషెస్ పెట్టిన టెంపుల్ గోల్డెన్ టెంపుల్ కూడా పోయినా అక్కడ అంత చూస్తే నాకు అనిపించింది ఏంటంటే ఈవెన్ దో దే ఆర్ అడ్వాన్సింగ్ ఈవెన్ దో దే ఆర్ getting westernized and using western resources but they are not giving up their culture and roots. They are not living. So I think India, I mean like right now, the way things are happening are going in really good direction. But India has to follow and preserve their culture. I think, not just for health reasons. So I think it's for you are what you are. We are Indians, and we'll be Indians whether we are living in India or abroad.
That's true. That's true. I think it was wonderful talking to you again, Doctor, this week. We will definitely continue. So, yeah,
Sure.
I want the viewers to know that in the next week, we will be talking a little on diabetes and hypertension. So, maybe we will cover hypertension, but then diabetes will be our main priority. Doctor, is there anything that you want to say to the viewers? What exactly are we going to talk next week?
Right. And, for my viewers, I really, want, especially my time, I want to use it appropriately. And I want to kind of bring up new, things rather than discussing the, same part. Let's say next week I want to discuss on diabetes and hypertension, but నాకు ఏదో మీకు తెలియనిది చెప్పాలని ఆతృత. సో భగవంతుని దయ వలన ఐ థింక్ వీ కెన్ కైండ్ ఆఫ్ లర్న్ లైక్ నేను కూడా నేర్చుకుంటా మీకు కూడా షేర్ చేస్తా. సో ఐ వాంట్ టు be in that perspective.
Yes.
But if you once we get a little more familiar, we can do question answer also.
Definitely.
Depending on how
Definitely.
we do. But
sure,
but
Doctor.
I'll do my best because I always feel that like giving back is important.
Yes.
So అదండి అందుకే I want to spend my free time to do something meaningful.
Yes. Thank you again, Doctor, for tuning into our show. It's wonderful having you as usual. We're going to continue next week too. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.